Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is going to be extremely important for those of you who have sleep apnea or know people who have sleep apnea, have partners who have sleep apnea. You don't have to stand the snoring anymore. We have the expert. Dr. Shapiro is absolutely the expert. He is an otolaryngologist, and he's just very smart, and he's located down there in Pembroke Pines. And so what we want to do for everyone is to listen to what the latest and the greatest sleep apnea tool is. What are you going to do for people?
All right. Well, first of all, thank you for those kind comments, Anita.
They're true.
In that intro, I appreciate that. So many people suffer from sleep apnea, and one of the gold standards for treatment was CPAP and BiPAP and AutoPAP, and a lot of patients do well with this. However, there are a lot of people who don't want to sleep with those devices or can't tolerate them. So your traditional treatment with a CPAP, you're wearing a device that goes over your nose and head, and we're delivering air to go ahead and deliver air so that you have constant movement of air going into the system so we don't stop breathing. So what happens with sleep apnea, patients will stop breathing multiple times throughout the night for anywhere from seconds to minutes, and it disrupts the sleep, and patients don't get a good night's sleep. Sleep apnea is a disease that affects millions of people, and what I'm going to talk about is one of the latest devices called the hypoglossal nerve stimulator.
Okay, wait. Spell that for me, please.
Well, let's call it by the name that is given by the company called Inspire.
Inspire. Okay,
Inspire. That's easy because Inspire is the company that developed it.
Okay.
And let's give them the credit. They are the only company that has this device, and they have trained myself and a few doctors in the area to go ahead and surgically implant this device into patients.
Where do you implant it?
So basically what this device does is it stimulates the tongue. So what happens a lot of times with sleep apnea, everything relaxes, the back of the throat, the tongue, and the tongue tends to drift back to the back of the throat. And what happens is then air cannot pass down through the throat, then into the trachea, then into the lungs. So,
that's why it's so dangerous?
Well, yes. What happens is you wake up and you certainly, when you wake up multiple times, you don't consciously wake up, but what happens is you roll over, you do things, and then you take a breath of air, and now you get oxygen back to the brain, because what happens is our oxygen desaturation, our oxygen levels drop below a critical level, and our carbon dioxide levels get elevated, and it stimulates the brain to say, hey, we need oxygen or we need air, and we roll over, do something, and we're able to get a good breath of air. So back to the traditional treatment, which is CPAP, BiPAP, we're actually just forcing air through the mouth or the nose, so it goes directly down, like into the lungs, sort of like blowing up a balloon, sort of. By that positive pressure, it keeps you from obstructing. So one of the main components of the obstruction is the tongue. So the tongue slides back and closes off the throat. So what this device does is the generator is basically like a battery pack, which is very similar to a pacemaker, and it delivers electricity, and the hypoglossal nerve, which is the nerve that controls the movement of the tongue, will force the tongue out the mouth. So your initial question is, well, where is this implanted? How is it implanted? So what we do in the operating room is we go ahead and make an incision in the neck, and then I go ahead and surgically, I'm able to identify the certain branches of the hypoglossal nerve, and I go ahead and attach an electrode to it, which is then tunneled underneath the skin of the neck and underneath the muscles. So when that incision is closed, you don't see the so-called wire that's being tunneled through the neck, and that wire gets tunneled over your collarbone or your clavicle to right over the chest wall area where patients have a pacemaker. So an incision is then also made in above the pectoralis major, your pec muscle, and a small pocket is made surgically, and the battery device and the computer, because it is also a computer, is placed there, and that electrode that is implanted on the nerve is go ahead and hooked up to the generator so it can stimulate electricity to cause this stimulation of the nerve, so then the tongue will protrude out the mouth. There is one other lead that is also implanted that goes from the generator, and we put that just in between the ribs, because what we need is a timing of when we inhale, we call inspiration, and expiration. So on inspiration, we want the tongue to come out the mouth so that airway is open. So this transducer that's implanted in between the ribs can help with the timing. So once this is implanted and surgically put in the body, the company Inspire, they have an amazing team. What they do then is program the generator to get it to work via electromagnetic waves and computers, and they're able to allow it to work for the certain parameters a certain patient might need. Now, there is a handheld remote control, because we don't want our tongue to, throughout the day, be constantly pulsing out our mouth. So the patient's able to go ahead and use the remote control to turn the generator off, and then before they go to bed, the remote control is used to turn it on.
Brilliant. You know, I was thinking about, as you were talking, because there are a lot of people who snore and they're in the dating game. And can you imagine what that's like without this? Must be horrible.
Correct. Now, snoring is one venture that we're talking about, and of course, sleep apnea is another venture. So, not everybody that snores has sleep apnea.
Okay.
But I have never diagnosed somebody that has sleep apnea that didn't snore. So if you have sleep apnea and you've had a proper sleep study done, I will venture to say for sure you're snoring. So with this device, you're treating two things. You're treating the sleep apnea, which is a disease which over years and years can put strain on someone's heart. So you're actually treating a disease. And a benefit to this treatment is the reduction or almost elimination in some cases of the snoring.
I see. So should people come to you for a sleep study first, or where do they go to find out?
Okay, so many times people will come to me to be evaluated for sleep apnea. So my otolaryngologist, like myself, typically do diagnose sleep apnea. Also, pulmonologists are involved in sleep. So either a pulmonologist or otolaryngologist will go ahead and evaluate a patient, send him for a sleep study, and then based on the sleep study, you'll get the diagnosis of sleep apnea or not. And there's different degrees, mild, moderate, or severe sleep apnea. So this treatment treats all three, of course. Also, there's a few small qualifications to be able to qualify for an Inspire. We have this index called a BMI. Patients need to fall within a certain parameters in the BMI. The larger, if your BMI index is too large, then patients do fall out, and this device does not work. And also, just prior to recommending this device, we do what is known as a drug-induced sleep endoscopy, where I will take you to the operating room, and we give anesthesia to get you to a certain part where you're just asleep, and then I can look with a special scope that goes through the nose while you're asleep. It's basically painless, and I can see what the tongue is doing and how it's collapsing, and if it's collapsing and falling back in a certain way, then we know that this device is going to be 90% success.
Well, I know that you have patients waiting, and I did grab you quickly to get you to do this. So you're listening to Dr. Craig Shapiro, and he is very big in the ENT. Well, let's see, it's called the ENT Associates, and he is located in Pembroke Pines. And let me give you a phone number of his office. It's 954-438-7171. Again, 954-438-7171. Don't waste your money or your time getting all these appliances that you have no idea about. Go to someone who's an expert. I know Dr. Shapiro for a long time. He is fantastic, and you should really go, make the appointment, and see what's happening, because it can really break up marriages, and it's not pleasant. So thank you, Dr. Shapiro. I know you have to go, but I appreciate your telling us about Inspire.
Thank you so much, Anita.
You're
it was
welcome.
my pleasure to speak to you again.
Okay, we'll try it again another time. Thank you,
pleasure.
Dr. Shapiro. Bye.
You're welcome. Bye-bye.